Welcome, everyone. We're in a room the size of a closet, and I've got a microphone. I like this. I'm Dr. Snyder, Larry Snyder. I'm the medical director for Sovereign Health. I've seen many of you are staff members here, but many of you have been here before, so welcome. It's nice to have you again this month. As you may know, that Sovereign is now 3.5 years old and has grown gradually and is now approximately 60 beds between Lake Arrowhead and San Clemente. We have about 35 to 40 beds in San Clemente now, and about 20 or so, 25, maybe close to 30 in Lake Arrowhead. And we span treatment for dual diagnosis, alcohol and chemical dependency, mental health, and also for eating disorders. And now have 4 homes in San Clemente that patients will live in. But today I am very pleased to introduce Miss Jasmin Rogg, who is the author of To Hell and Back. She is a licensed psychologist, MFT, licensed marriage and family counselor with a master's in counseling and clinical counseling. And she is here to discuss and to talk about her book, How to Have Feelings and Still Recover from Drug and Alcohol Dependency. So without further ado, let me turn you over.
Thank you.
Do you need this?
I don't know. I don't need this.
No?
Do you hear me? Hi, everybody. Welcome. Since I am assuming that there are some recovering alcoholics in the audience, there is nothing to fear. There is nothing to fear. You're exactly where you're supposed to be. You're perfect, whole, and complete. I'm so glad that you welcome everything and you resist nothing. I'm saying these things because I work with alcoholics in recovery, and it is a disease where we suffer from 100 forms of fear, which then we self-medicate. I just want to start out by saying that I use the terms alcoholism and addiction and chemical dependency interchangeably. The way I understand it, it's not so much about whether a substance is legal or illegal or prescribed or not prescribed or powder, liquid, or pill. It's more, or about the mode of administration. It's about the fear. It's about the discomfort with life. It's about not being even so very sure whether you want to be here. Many of us are still in the trying to decide stage on that one. And so the recovery is a lot about learning or becoming willing even to befriend reality. The title of my book is To Hell and Back, because what we do with this condition that we have usually takes us to hell, and some of us take the opportunity to get back from there. I did. The subtitle of the book is really what it's about. It's how to have feelings and stay sober at the same time. If you like the subtitle, you are most probably an alcoholic. Non-alcoholics find it weird and awkward. They just someone say, what? They don't really understand what that even means. Because I think one example that I can give about that is what my son said. He was invited to give a speak on the music business in Mexico, and I said, so how did you do it? How did you feel? And he said, oh, I thought it was good to be outside of my comfort zone. And I thought to myself, I've spent my whole life outside of my comfort zone. but you know, for him it's different. He's just not an alcoholic, and so he experiences life differently. He does not go through life 24/7 thinking, how should I self-medicate right now? It just doesn't like come up for him in that way. And he would never drink a glass of alcohol if he was to drive or have like an important day tomorrow, you know. So alcoholics are different in their approach to life. Most alcoholics, they don't really, it's not really so much negotiable whether to opt for hedonism. It's experienced as a necessity, and it's very it requires a reorientation. It requires a psychic change, a cognitive restructuring to change that and to go for recovery or give it a chance at least. I have, I'm doing this here. I was thinking about how should I start. I want to say I'm more a writer than I am a speaker, but the truth is I started out with speaking a lot in the rehabs, and I saw that the clients there, they were so lost, and they so didn't understand how anything can have anything to do with a 12-step program. It was so like not tangible to them. Anything that we were saying or that they had been exposed to in the recovery world didn't make sense to them. And so I tried to explain it a little bit, to say, look, this is what this is, and this is what this can do, and this could be that. And they said, oh, really, thank you, now I get it. And so I began to like tell them a little bit more, and then sometimes I thought, I was just now so like eloquent, and I was so happy with myself, and I thought, neither I nor they are going to remember what I said, though. You know, it's like come and gone. And so I started to write it down. And so that's how my book came together. I'm explaining alcoholism. I'm explaining the disease, and I'm explaining the personality of the alcoholic, which is a little bit different. Of course, these are generalizations, but there are differences that often can be seen. And then I'm also the main part of my book is the part that I call daily mental hygiene, which is about how can an alcoholic make it from the moment that she opens her eyes to the moment that she arrives at an AA meeting, because this is the bridge that she needs to go over. Now this may sound really weird if you're not an alcoholic, but if you're an alcoholic, you will be in agreement with what I just said. And this is some of the difference that happens, and that this is the particular challenge of the alcoholic, that waking up in hell kind of thing, and how to want to get up, how to want to participate in life. Most alcoholics tend to withdraw and isolate a lot. The disease is a lot about that, and so recovery is a lot about engaging in life. So when I prepared this, I wrote down some stuff, and then I had a new paper, so I don't want to be reading here too much, but I wanted to just, this was my preparation for this presentation here. What I wrote here is this, it's not, there's a quote that I wanted to start this with. And the quote is, how many times have we heard people come up to the podium with one day who said they were sober, and then they took a Valium for their back, and they woke up again with a lemon peel in their ear, whipping cream in their hair, in bed with their sister, and in jail. This is a quote from somebody, a speaker at an AA meeting. So what I'm saying is this: human consciousness is enigmatic, attention is selective, memory is elusive, motives are mostly unconscious, awareness is vague, and reality can seem undesirable. So for an alcoholic, life is not, they say a lot that they didn't get a blueprint for life, or they felt that way. And so it's complicated. It looks like alcoholics are born with a genetic predisposition to react differently to alcohol and also to other substances. And then there is usually, for alcoholics, there is usually some vulnerabilities that seem to be acquired. So, in other words, you're born with this condition, and you are very sensitive and very emotional. And then you're exposed to some trauma of some kind, either in in infancy, in the womb possibly, in early childhood. It can also be a little bit later, but my understanding is it's mostly in the early years. There is attachment, there's problems with attachment. There were issues in infancy, in early childhood with the mother. There was abandonment or incest, or there was abuse, neglect. Alcoholics tell heartbreaking stories. There's a huge overlap of this type of trauma. There seems to be a huge percentage of dual diagnosis with mood disorders, depression, anxiety, bipolar illness, thought disorders as well. It's a complex condition that alcoholics deal with, and I'm going to say, this is my personal guess, take it with a grain of salt, but I'm going to say 80 to 90% of the women that I have been working with were sexually abused or molested, most of them in childhood. I find that stunningly shocking, but this is, over the many years that I've been working with this population, this is what they're saying. Nobody makes this up. Okay, so the situation that the alcoholic deals with is that if you want to offer a solution, you have to provide something. You can't take their dope and not give them something. So, you know, you can't say, well, deal with it, you know, hang in there. Yeah, in a way, yes, but you have to offer something. And what you offer has to be on an ongoing basis, because what we're dealing with is a chronic condition, and it requires ongoing treatment. So as people as treatment professionals, we focus on detox, we focus on early recovery, which early recovery, depending on how you define it, can be 30 to 90 days. But it really, I'm going to say it's more like a year, depending on the kind of substance. It's like, let's say, if you're dealing with certain kinds of substances, it's longer, and with other substances, not so long. But really, the first year is probably crucial for anybody who wants to change their life in that manner. What I came up with here is this little logo that I personally really like. And that is supposed to say, the truth in a frame of love gives you wings. In other words, with the fragmentation that happens for the alcoholics through the trauma, through the adverse childhood experiences, through their personality, then adding some crystal meth or some, I don't know, hallucinogenic or something to the mix, and then smoke pot all the time and drink to black out, which is, you know, what people do all the time. And then maybe after, like, if you don't black out because you have more coke than you have the alcohol, then maybe you need a sleeping pill, you know. So you're dealing with like lapse in consciousness. There is fragmentation. There is confusion, and that adds to that anxiety that people are already dealing with. And so you have to offer them something that where they can say, okay, and this really goes in psychotherapy for any kind of crisis situation. You offer guidance. You don't go under the surface and upset them more. What we do is we offer guidance. That's in early recovery, that's vital. You know, you say, this is what you do. You dress up, you show up. Really, what a concept, you know? And you do this, and then you do that, and you spell it out. And so the truth in a frame of love is one of the main things, because alcoholics are a lot about hiding, so being so fearful and lying and manipulating and deceit. And then next thing you know, I've been lying and manipulating, and I don't even know what. It's very confusing, you know. So the other person may not remember your lies, but you remember being confused, or you may not remember, you're just confused. And so finding the truth is really important. And I want to just say a little something about the diagnosis. Really simple. I like to look at it that way because it gives an understanding a little bit. I have here the categories. I have them in my book here. There is categories. I just find it interesting that the DSM-4 adds caffeine and nicotine. Just saying. I mean, if you don't like it, you can forget it, but I'm just saying. And so that's, they have all the substances that we kind of know are addictive. I just want to say that they also add, and many people don't like this, they add sedatives, although those are you know, prescribed. People often say, well, this is my medication, I got it from my doctor. And you know, as I said, it's the biology doesn't differentiate. So when people often, they are not sure whether they're alcoholics because they want to deny it, because they don't want to go this route. They don't want to stop drinking. They just want to stop suffering. They don't want to have like a hangover or a blackout. They want to learn how to do it better. So I use here, I think it's a nice tool, and this is why I copied it in my book. It's the DSM-4 differentiates substance dependence or addiction from substance abuse. You know, because most people want to say, well, I'm just abusing it, and I'm just drinking or using a little too much. I do a little recreational crack, and you know, like that. And so I asked them this. There are 7 questions. You don't have to tell us, you know, I'm just asking. So the first one is tolerance. In other words, are you using more now than you used when you first started doing this substance, whatever it is, alcohol, are you drinking now more, or heroin? What a surprise. At first, a little amount was enough, then later it wasn't. Or benzos, all of it. Second one is withdrawal. If you stop doing it, do you feel extra miserable? Do you have anxiety and all these conditions, heart palpitations and all this stuff? Do you, number 3, do you take the substance more than you had intended? Like, does it happen that you say, I'm just going to drink a glass of wine, but then you wake up again with the whipping cream in your hair? Then number 4, a persistent desire or unsuccessful efforts to cut down. So have you tried to cut down but couldn't? Number 5, do you spend a great deal of time on it? Number 6, important social, occupational, or recreational activities are given up or reduced for it. In other words, do you even have a life left? Number 7, you continue using in spite of persistent or recurrent physical or psychological problems. Now, anybody that I ever asked these 7 questions usually said yes to all of them. And then, and this is like a cheap trick that I did, then I said, well, it says here in the DSM-4 that substance dependence is manifested by 3 or more of these. Most of them had to say yes to all 7. So, you know, it helps to deal with the denial a little bit, because it's important if you want to deal with a solution to a problem, you want to first identify the problem, you know. So there is that. I also want to say here, this is something that is not, that I put in here, that is not in the DSM-4. There are two phenomena. One is what I call adaptation, where the substance stops producing the desired effect. In other words, people say, I got to where no amount of alcohol was getting me drunk anymore. That's adaptation. That's a strange phenomenon. Sometimes it can motivate somebody to want to get sober. And then rebound, which I know from two classes of substances. One is benzodiazepines, which are anxiolytics, which means they are used for anxiety. And the rebound can be where you take your benzos and you have the anxiety anyways. So, and you have more. So you have more anxiety while you're taking the benzos that you started originally to reduce the anxiety. Like, it reverses the mode of functioning. And another one where I've noticed this is with opiates, which are analgesics, which means they're painkillers. And for people that are addicted to opiates, it's to where they have this hyperesthesia, it's called, this hypersensitivity. And especially when they're detoxing, where they feel their hair hurts, their skin hurts, for no other reason that they're detoxing from opiates. So these are 2 phenomena that I think belong in here. The brain of the alcoholic. Let me just look here. I had a nice poem that I wrote these last days. Maybe I get a chance to read it later. I just want to say the quote, because I'm always gathering these quotes from the AA speakers. This one says, "Of all the things I lost in life, I miss my mind the most." I don't know whose quote it is. I just think it's kind of nice. So because recovery can be so much about getting your brain back, among other things. And so I want to speak, well, for one, I want to give you an example. I think it can be, for some of you, it can be interesting to hear an example, a case study. And I want to say this because it's just happening right now, and it's been really a very interesting case. This patient of mine, I've been working with her for many years. And I first met her in a detox, and she became my patient. She always had the diagnosis of depression and anxiety. She was obese, kind of, and we've later, I mean, I thought that she was bipolar. In my opinion, she was not diagnosed properly, but then when I spoke to her psychiatrist, he said, "Oh, Jasmin, you might be onto something." So she got sober, and she did fairly well, given that she had been coming from this extensive cocktail of substances when I first met her. And then she got pregnant again, which was a little bit problematic because in early recovery and with all her issues. But she's married, and she has a very dedicated, codependent husband, and he's a very, very functional, surviving provider. And he, after work, he knows to take care of the kids and to deal with everything. And so she was doing okay. She was showing up for herself and for her recovery, and she came along, and eventually I got her to even start going to AA and get herself a sponsor. So far, so good. And she always tends to somatize. She has a history of chronic pain, of fibromyalgia diagnosis, and other stuff. But she was doing good, and she was always she was taking Lexapro and Neurontin, and she was good. She was like stabilizing over years. And then what happened was she comes in and she says, and I'm seeing she looks a little bit disheveled, and she had lost like 50 pounds, which she was very pleased with, of course. And so she went like, yeah, it's too detailed. But so I said, what's going on with you? What are you doing with the meds? Tell me, did you see this doctor? Did you see that doctor? What are they, you know? And so she says, yeah, she has now been diagnosed with ADD, and she's getting Adderall. And I say, huh, you don't have ADD? She said, oh, yes, I do. I said, oh, no, you don't. I would have noticed this because, like, I am, in our sessions, I would have noticed this. But she was down with the Adderall. I wasn't going to be confrontational with her. So so then she says, yeah, and then Adderall is speed for the amphetamine. And then she was saying with another, she was also adding other substances. Anyways, the long story short, the little Adderall script took her down, of course. And so when we got her to be readmitted to detox, she had been on, I wrote it down so I don't leave anything out, she was on 14 substances from a doctor that neither I nor anybody else and nor the other two doctors knew. She had been, she's a very smart woman, she had been very creative. She found another one, and so she was prescribed, in addition to the Lexapro, Wellbutrin, and Neurontin, she was prescribed Provigil, Vyvanse, Adderall, Dexedrine, all speed. Then human growth hormone, because apparently you can lose weight, which she was like wanting to do at that time. And then because all of that was kind of aggravating and like made her tense, she added some Vicodin, hydrocodone, and OxyContin. And then just to like kind of, you know, like the frosting on this was Valium, Xanax, and Lunesta. So you have like a deadly cocktail, really, is what you have, especially for somebody who kind of stops eating, more or less. So when I saw her now, she was, of course, it was really, really, really hard for her. And it was confusing, and there was some fragmentation, and it was really difficult. And so I think this is a beautiful example. Well, not so beautiful, but it's a clear example for what we're dealing with here. That if you are an addict or an alcoholic, it doesn't really mean, it's not really so important which one of the addictive substances you relapse on. It's gonna snowball. That's the part of the genetic predisposition. And that's just how it goes. So it's important to not do addictive substances of any kind if you have the disease of alcoholism, because it's just that way. So I want to, there's another quote. And this is a quote from Saul Bellow, which I love. He's a great writer. There was a disturbance in my heart, a voice that spoke there and said, I want, I want, I want. It happened every afternoon, and when I tried to suppress it, it got even stronger. It only said one thing, I want, I want. I think this is a good one for alcoholism. So, okay, so let me look here. I want to speak a little bit about the addictive brain, just to kind of identify the addictive brain, how it is different from people who are not dealing with this. And there are 4 addictive brain circuits that I want to mention. And yeah, the first one is the opiate circuit. Opiates are, like I said before, they are analgesics. Which is a painkiller. Opiates are heroin, morphine, methadone, codeine, hydrocodone, OxyContin. You get the point. Vicodin, Percocets, that kind of substance. Now, while the way that they work is that they mask the pain, that you just don't feel it while it's there. And as some of us have found out while they're doing that, they also make you feel euphoric, which can be very attractive for somebody who is in pain, whether it's emotional or physical. It just removes it and make you happy. That's a combination that for some people, they will never forget that. And they want to recreate it until they die of it. And there is the opiates. They mimic endogenous substances that are released for. It's called the love chemical. They're released like when a baby nurses and during falling in love and sex, and it's that kind of like pleasant state that they artificially can create. So it's of course very attractive, if you don't normally have this. If you let's say, if you have been abandoned by your mother, or you have been abused or mistreated, and to where you just hardly ever naturally feel this good. So that's the opiates. The second addictive brain circuit is the dopamine system. Now, the dopamine system is also called the survival system or the reward system. The dopamine is what makes us feel like we want to do something, like curious, motivated, going somewhere, getting things done, that. If people have low levels of dopamine, they're lethargic and listless, and they're not really very interested in doing stuff or in participating in life. And so the dopamine, it's called the reward system because dopamine rewards us for life-sustaining activities, such as if, let's say, I'm cold and it's been raining and I'm wet and I go inside and I put on some dry clothes. Ah, that feels good. Dopamine surge. Or I'm hungry and I eat. Ah, dopamine surge. Or I have sex. Hopefully also So the dopamine system is a reward system, and it makes us feel good. But for addicts, it's typically a little fickle. It's not really. It's just quite not enough for that type of person. It feels like there should be more to it. It should feel better, and it doesn't. And there are theories about it, lack of dopamine receptors, or to account for the low levels of dopamine. You know, people do research on this, but the fact remains that for addicts, it's usually there is this ongoing dysphoria a lot, and this is partly related to the low levels of dopamine in the brain. And if you interfere with it, like this one client did with these kinds of substances, and then you have to stop the substances because you're in a rehab, the dopamine levels are really low, and then you feel really horrible and angry and anxious and depressed, and it's brutal. The third system is the adrenaline. Adrenaline is the stress hormone. And we stress out. Addicts stress out. The stress can be triggered by something that is not even a stressful event for anybody. It can be just anything. It can even be a thought. It can even be a memory. As in PTSD, it can be a remembered, like a re-experienced trauma. And it can trigger the whole adrenaline flooding thing in the system. And alcoholics typically don't know how to self-soothe. Apparently healthy people, they go back to baseline within 3-4 minutes. Alcoholics, not so much. For alcoholics, it can take hours to calm down. So there's that. And then to make it like a whole package deal, there is the impulse control thing, which for alcoholics is very minimally there, because that has to do with the brain functioning, in the sense that if the limbic system, the midbrain, is very active, simultaneously the prefrontal cortex, which is right in the front here, is underactive. So this has to do with the fight or flight response from our evolution of survival in the wild, where, let's say, I am a Neanderthal girl, and there is a bear, and I'm not supposed to really look at the bear and say, what a pretty creature this one is. I'm supposed to fight or flight. Well, with the bear, I would, run or something, or not think too much. Time is of the essence. So it seems to me that this would be the explanation for that fact, that if we have very high emotions, the prefrontal cortex is underactive. Now, the prefrontal cortex is the location of reasoning and differentiating and language. We all know when we're really angry, we don't know what to say. We don't know to differentiate. It's all black and white, and it's all about let's go, you know, like that thing. So that's the addictive brain that in a hugely simplified form, but this is really, these are the aspects of it. If you're interested, there is lots to research on the internet if you like. And so the main part of my book and of my work with newly recovering addicts is the daily mental hygiene, the recovery tools, which one of them I said when I first started speaking is the affirmations to counteract and to offset the negative thought pattern, because for alcoholics, they often say this to me: I am shit, it doesn't work for me, I can't change, that's just who I am. You know, and these are automatic thought patterns, which I think it's a misnomer. It's called automatic thought pattern within that frame of thought, but it's not really a thought, it's more memory. It's a memory of a thought, or it's just a memory of somebody that you heard. And for most people, they heard such things when they were little by parents that told them you're no good and you'll never be smart or whatever. People do such things with their children. And so so there is that negative thought pattern, and that needs to be offset. And one of the things that we do is to kind of identify that. That's part of the work that we do, to identify that and to replace it with something good. I'm perfect, whole, and complete. All I have to do is make it through this day sober. That's all I have to do. All I have to do is to dress up and show up. I can do that. Just for today, just for today. I only have to show up today. That's so relieving. When you're like tripping over, I am no good. Do I even want to live? You know? No, you go back to just for today. All I have to do is dress up and show up. And you repeat this, and you repeat it loudly so you hear it. So the auditory memory supports that. And I work with my clients to work that out. It's also in the book. And then prayer. Prayer about mainly the gratitude, because the alcoholic thinks, oh my God, I can't do this. This is horrible. I hate my life. I don't even want to say it right now from the negative side, because I hear myself saying it. It's not good for my emotional climate. So you get the point. But for the prayer, it's very important to do a gratitude list. To just say, thank you that I'm clean and sober today, that I can see and hear and walk and talk, that I can work, that I can breathe, that I have a place to sleep, that I have food, I have love in my life. Thank you for the beautiful blue California sky, for my friend, family, whatever you can come up with. If you can do that, you will immediately and always be in a better mood, because you will claim the good, you will own it, you will remember it, rather than always focusing on things that cause you fear, which really the alcoholic does. Oh my God, I'm not going to reach this, and oh my God, I'm going to lose that. And so they're always in fear. And so then, okay, so we have prayer, affirmations, breathing exercises. Most people, when they're new in recovery, they're not really very familiar with meditation, or they would maybe not be doing drugs. And so it's hard to start that when somebody is newly sober. But what you can, though, start breathing exercises. Because when you're in fight or flight mode, the breathing is flat, or people barely even like breathe, and shallow, not flat, shallow is the word. And so the breathing exercises help to breathe deeply and to reactivate the part of the nervous system that is active during relaxation, during sleep, for healing, for well-being, which is the parasympathetic nervous system, and to snap out of that hyper-excitation state that people, when they're so newly sober, are in. So I offer some breathing exercises, and then once people get used to that and they start to notice how good it feels when you have some tools to self-regulate these feelings, then they become a little bit encouraged, and it's like a reinforcer, and they become more motivated to do this. They think, oh my God, this can work if I do these affirmations and I do some prayer, and then I breathe also. I breathe. I can do this. I can breathe. You know, and these are little tools. It's easy to do. I'm not saying you need to you know, climb a mountain. It's pleasant, easy stuff. However, it's very, very, very powerful, because you counteract that hyper-vigilant, hyper-excitation mode that is so unbearable and renders people so dysfunctional. And so the breathing, yeah, and then also some life skills, like some self-care stuff. Opiate addicts in particular, but most of newly recovering addicts are not thirsty, ever. They do not drink water. They never drink water. They just really don't. And so they have migraines, and they have headaches, and they have all kinds of conditions, and I don't even want to get started on the digestion. They don't drink water. So one of the things is to teach such things, so people know that, oh, maybe drinking water can also be, I drink my water, I breathe. These are things that are like reinforcing. I remember I once was working with somebody, and she always had her dirty, her garbage. She wouldn't take her garbage out. And so I would make a deal with her that she would take her garbage out. Very smart woman, not, you know, this has not so much to do with intelligence. Take the garbage out and then confirm to me with a little email that you did. And she did that. It was a life-changing thing for her. It seems like little, and it seems not even worth mentioning, but for her it really made a big difference. So these are little things that are doable, and as such they reduce the anxiety, that sense of being a loser, a pathetic loser, and oh my God, not me, never ever. You know, because you see, oh, well, if recovery is only about doing these little things, I do a little breathing and an affirmation, and maybe I read a little in a big book, in the big book of Alcoholics Anonymous, or in a little some spiritual reading, and I can feel okay, and then I go and I do I go to my AA meeting, or I go to, and I shouldn't say oh, and I go to my therapist. And for those people who have severe dual diagnosis issues, I see my psychiatrist. Personally, I recommend a psychiatrist that is specializing on addiction medicine, so that they don't, you know, defeat the purpose. And wait, I have this on the next, maybe. Yeah, on this one I have it. 12-step programs, the tools, A few minutes a day, it's really not such a big deal, but it makes a gigantic difference. Psychotherapy is for people that have PTSD issues to deal with, or other diagnoses. And medication if it's necessary. Alcoholics have, this is what alcoholics are dealing with, and there goes a certain personality goes with this. If you're constantly feeling restless, irritable, and discontent, you're going to end up being selfish, self-centered, and inconsiderate. What else are you going to be? It's like hard enough to make it through the day. You can't really consider other people's, feelings. It's like you're busy, just making it, not going under. So the recovery requires a psychic change, a complete psychic change, which can be accomplished through this combination of mindfulness, meditation, and the program of Alcoholics Anonymous, or these other 12-step programs, and psychotherapy. It really can happen, but it doesn't happen overnight. And there is I have all these that I mentioned here, these concepts. I'm explaining them in the book. The differentiation between anger, which is a feeling, and aggression, which is acting out on that feeling, which is the behavior, or resentment, where people like to say, like this one client saying, it wasn't me. So they want to disown their behavior. They're ashamed. It's horrible. They think, I don't know where I was, and I don't know who I woke up with, and all this stuff. They say, they want to blame it. It's my dad's fault, it's my mom's fault, it's my husband's fault, it's somebody else's fault. They want to blame, they want to have resentment, disown the responsibility, and all that interferes with the sense of self and the confusion. Then there is the fragmentation, then there is ambivalence and conflict, and all of that makes it really makes it treacherous, makes it like a toxic swamp. And so, and all of that can be handled one day at a time through the program of recovery that I'm proposing here. And this brings me to this quote that I think is very important. Make your recovery your number one priority, and everything else will follow. I am a big proponent of people being in rehabs and sober livings and IOP and in treatment as long as possible, because it takes all you got. If you have simultaneously, if you have to keep a job or do something else, in my experience, it really, really reduces the chances for recovery to like a minimal chance. So this is what I had to say to you. Thank you for your attention. Is there anything you want to say or ask or add or disagree with?
What's radio days?
Oh, radio days. I made that up for, it's a metaphor for anxiety. That when people have this ongoing anxiety, they say that they have these loud voices in their head, or it's like a disharmonious inner melody, so if you wish. And I said, as a metaphor, I said it's like having death metal on your radio channel, you know, where for me it makes me, you know, like and so to change it to something to a channel that is soothing, because you cannot change the radio off in your mind. The mental process, the mental chatter it's just there, and it will continue, but you can't change it. You can change it to a friendly content, which then will create a friendly emotional climate. So that's what that paper is. These are all just, this list was all just some of the main concepts in the book.
When you mentioned prayer, and you talked about prayer being part of the affirmation, I'll never forget a patient who was talking to me about his early recovery, and he said, his sponsor said, say this prayer. And he said, I don't have any religion, I really don't believe in God. He said, so why would that help? And the sponsor looked at him and just said, just say the prayer. So the guy said, okay, I'll say the prayer. He decided that he would go home and he would just say it. He didn't believe in anything. About 3 or 4 or 5 years later, he was still sober, and he said, you know, I still don't have any religion, but I say that prayer every day. And it's really had a positive effect on my life.
Yes. Thank you for saying that. That's such a...
Yeah, because of the whole concept of higher power and God sometimes falls flat on a lot of people, which is unfortunate, I think, but that's the way it is. One of the things I also wanted to mention, you mentioned about how the different drugs really don't matter. It's all about addiction. It doesn't matter really about which drug you're addicted to. And actually neurobiology supports that, because there are certain pathways in the brain that all addictive drugs follow, and they end up like kind of like a cascade of dominoes falling and hit this one spot in the brain. And one of the interesting things that I discovered was that there are 35 million drugs known. Only 100 of them are addictive. And there are classes of drugs in that 100, so there are several classes that 100 drugs are addicting out of 35 million. That's a pretty interesting phenomenon. But it does go to your point.
Maybe the 100 drugs that are addicting are more similar to the endogenous.
Well, they all follow this same pathway, this same neurobiologic pathway that every one of them. And pot was always thought to be not addicting, and just this gateway drug. And as it turns out, pot does exactly the same thing as the opiates. They all do it in a little bit different way, and they have accessory side effects, but there is a specific pathway that they all follow. And marijuana is just and cigarettes.
Yeah.
They all follow the same reward system pathway that you're talking about. Anyway, thank you for your talk. It was very good.
Thank you. And I want to add about prayer. I know exactly who listens to your prayer. You do. I don't know who else listens, but I know you do. And that's a main thing that changes, that promotes a change, like you just said. Anybody else?
Thank you.
Thank you.